dietary supplement that people started to take and abuse. And when they say that it has less overdose potential, I disagree. Hey everybody, welcome back to the channel. This is Dr. B Addiction Recovery, and the topic I want to briefly give you an overview on today is gas station heroin. What is it? So let's get started. I'm going to break this down and to present to you what the issue that's presenting itself currently is, and it's all over the media. Then I'll get into a little bit of detail about the background and the details of what's inside this stuff, and then I'll talk about some of the intoxication withdrawal symptoms and give you a brief recap and my thoughts on it. Let's get going. Gas station heroin. This stuff's actually been around for about 20 plus years. It's making the news at this time, more particularly so in some of the states that are more affected with the opiate epidemic and addiction than other states. And it might be spreading, but at this time I know about Mississippi, I know about Kentucky. I'm not sure if it's in Ohio as well. I know about Indiana. It's really making its presentation and its presence well known there. How is it doing that? People are buying this stuff over the counter at the gas station as a dietary supplement, sometimes online, on the web, as a mood enhancer or a cognitive enhancer. Remember that whole thing, cognitive enhancement drug. They're buying it and they're starting to really abuse it, get addicted to it, have serious cravings, withdrawals, intoxication, and now it's starting to be banned in multiple states. We'll see how this goes and how it's going to develop, but hopefully it'll be getting taken off the market in a lot of these states. We do know that over the last 20 years, so remember it's not new, there's been over 200 calls at least to poison control centers. Some of those have been for severe intoxication, which seems like the hallmark of it as they describe it is lethargy and anxiety or agitation, or people going into severe withdrawals, which present themselves like opiate withdrawals. Agitation, sweating, muscle aches, GI issues, okay? So that's how it's presenting. We know that there's been at least 4 deaths. We know there's been ICU admissions. Again, it's not that new. It's been around for about 20 years. And it's giving people an opiate-like high. Let's move on to what's actually in gas station heroin, which goes by the name of Zaza Red, Zaza White, Tiana Pegasus, sold as a mood enhancer sometimes, sold as a cognitive enhancer sometimes, and a dietary supplement. Let's move forward. What is this stuff? It's an atypical antidepressant approved in Europe in the 80s. What is an atypical antidepressant? Briefly, let's go to the history of that and get to where we are now. In the 50s, they realized that medications, for example, some tuberculosis medications, were able to treat depression. And they came up with the monoamine theory, or the catecholamine theory, or let's just call it a serotonin theory, which, you know, depression has something to do with lack of or some sort of imbalance of serotonin in your brain. So they moved to try to see what they can do about that, as this kind of medication, which was initially for tuberculosis and a couple of other ones, were treating depression. But there was quite a few side effects with that. And they're like, well, we need to hone it in on serotonin. Next, we went to Prozac, selective serotonin reuptake inhibitor, which made it more available in what's called the kind of neurosynaptic space, so it could be uptaken by the neuron and sort of increase your serotonin transmission. As time went on, they realized that, well, you know, this isn't hitting everybody, and a whole bunch of nuances occurred that we really realized that the story is a lot more complex than just serotonin or even other monoamines. Okay, we even have theories now about inflammation of glial cells and so forth. And they started to sort of developed second generation and even now third generation antidepressants that hit multiple other neurotransmitters and receptors. That's for another place, the efficacy of that, how that works. But in this pursuit, I'm sure, right, this medication, Tianeptine, came about. And it's very complex. It hits glutamine receptors. It has it has something to do with NMDA. And so it's really a serotonin modulating product, right? And serotonin enhancer. But along this road in the last 20 years, they also realized, whoa, this stuff is hitting opiate receptors. It's hitting the mu receptors, which have to do with addiction. It's hitting other opiate receptors. It's really also the nucleus accumbens, which is known as part of the reward circuitry place and the big place for dopamine and addiction. It's really hitting there. And then, they realize this stuff is really increasing dopamine levels in the central nervous system. In addition, in Europe, although there was initially no thought that this stuff can be abused and there could be addiction and abuse potential, they started noting, even in psychiatric patients that were inpatient, just across the board, that this stuff has pretty significant abuse and misuse liability, in particular for those that have a substance abuse history. Now in Europe, Russia, Asia, this stuff is starting to be more and more and more regulated. Never got approved in the US. Why? I'm not sure, right? I don't think it was because it had very negative side effects. In fact, I think this drug, with further investigation, very tight regulation, dosing regulations by the doctors, can have significant impact on depression, anxiety. In fact, it's also used for asthma, IBS, potentially PTSD. I don't know, but I'm saying it's not a bad drug, just like many drugs can have an abuse potential, but they can be prescribed in a very, very controlled environment and close monitoring of the physician. But it was never approved in the US, and I suspect that had to do something with patents and finances. Doesn't matter. But nevertheless, it made it into this into this not illicit, but legal market of dietary supplements, and they have been pushing it, whether it's online or now we're hearing about the gas station over-the-counter dietary supplement that people started to take and abuse. Okay, we know that intoxication, as it has presented to a lot of the poison control centers, has intoxication is with lethargy and sort of anxiety and dysphoric mood. We also know that withdrawals are very similar to opiate withdrawals: sweating, abdominal issues, GI issues, anxiety, muscle aches and pains, myalgias they call it. So where are we at with this stuff? Okay, it just seems like every single day something new comes up. The point of what I'm trying to describe is to educate and give you a formal understanding of what these things are and take sort of the magic out of it. This stuff is pretty dangerous, because one other thing that you should know is the average dose that's prescribed per daily. It's something like 12.5 milligrams twice a day. It could be up to 50 milligrams total a day. The people that are abusing it are taking 50 to 100 times more of that in a day. The withdrawals are horrendous and have been using it for a long time. Keep in mind, this stuff is not just hitting the opiate receptors. We're dealing with many other receptors and neurotransmitters. And we already know a lot of people that are on any kind of psychotropic, whether it's benzodiazepines or antidepressants or some of the other ones, are having significant withdrawal issues. Now you're throwing this in the mix and it's not regulated, and people are putting themselves at incredible risk. And when they say that it has less overdose potential, I disagree, because I think we're going to start to see that as people combine this stuff with alcohol, with opiates, with benzodiazepines, or even with methamphetamines, and this kind of adds to the cardiotoxicity of the methamphetamines. So this stuff is pretty dangerous, and I think some of the states are going to start to really come down on this stuff. One last thought I want to leave you with is the issue or the point that here we have an antidepressant, and before they even knew it, eventually they found out this stuff hits the mu receptor and increases dopamine. And oftentimes, I believe it has been used for treatment-resistant antidepressant. That being said, what a lot of people don't know is that there's been quite a bit of small studies. I haven't looked lately, but traditionally in the past, there was multiple small studies where they used low-dose buprenorphine for treatment-resistant depression, and they got significantly reduced symptoms and statistically meaningful results, even though they were small studies. And this is a little bit of a sidestep, but think about the complexity, the intermingling of a lot of these issues, including opiate abuse, substance abuse, anxiety, depression. Which came first? What's the person's clinical history where they ended up? Nevertheless, sometimes you can't tease through that as you're treating a patient dealing with substance abuse, but to know that buprenorphine product can also be used to treat the depression after stopping the use of opiates is very important, significant, and somehow it ties into this whole issue of why gas station heroin may be a substance of significant misuse, abuse, and illicit consumption at times. Thank you very much. Hope this helps. I'll see you next time.